Well, go ahead. Dr. Simone, if you're there, we want to make sure we bring you on. She is a doctor, and she also is a patient, and she wrote a book, A Doctor in the Patient Body, if I'm not mistaken. But you can add it in there, Dr. Simone. If you,
Patient with patients? No.
No.
Dr. Simone, can you show your name so we can invite you?
She's on Facebook. She's on
Facebook, yes. She's not on Instagram.
What's her at?
Her name, no, hold on. Sorry. I told you it was cinnamon. Her name is Simone, S-I-M-O-N-E, Eastman.
S-I-M.
O-N-E, Eastman, E-A-S-T-M-A-N, man, Eastman, and then U-W-A-N.
Hold on. She's not popping up.
We're gonna keep going, and now if we who gonna work? You gonna invite somebody in? Vicky?
She has to be on live in order
Okay,
to.
then I'm trying to go to her.
That's on Facebook, right?
Yes. Right.
Okay. Yeah. She have to.
Okay. Let's get started, and then if she comes in, Ricky, you'll invite her in?
Yeah.
Okay.
Because she have to hit that green button. Yeah, she have to hit that green button.
No. Ricky, thanks. This how she looks. No,
Okay, with the red. Okay.
I don't know if she changed the profile picture, but that's what I have on. Okay, we're gonna get started.
Yeah, let's get started.
All right. Once again, thank you for tuning back in.
Her name is Isma?
Yeah.
Yeah, she's
there. You see her?
She said I need her.
Oh, wait.
She ain't here.
Well, she just.
You got her on.
No, I only got on this.
Okay. Okay, don't worry. Come on, Jesse. Let's get started. If you see her name come on the Facebook,
I got you.
Thank you. Okay.
I was passing them out.
All right, ladies. Thank you for joining us. And once again, for those who are coming back in, this is Spotted Through Our Pain TV. This is Carlos, and I'm Mayo.
The women edition.
Sorry. We just trying to jump right back into it.
All right. So today on this episode is going to be the women talking about what they go through. What dealing with sickle cell anemia. We have with us today Maya.
Hello.
We bring it back Jessie.
Hi.
And
and our first timer,
Annalise.
Annalise. And
Anais.
All right, so we got the name, and we have our famous Dr. Harrington, Thomas Harrington, with us again. So we're going to be talking about some of the issues that, as women, we go through with sickle cell disease.
Okay.
All right. I want to ask my ladies, when it's time for, I know Dr. Harrington already was touching on this, but let's talk about it because we actually go through it. When it's time for, our menstrual, is it difficult for you at that time of the month because do you see yourself having more crises at that time of the month, or is it just a regular menstrual for you?
Well, I do personally as of right now. Today I just took medicine a few minutes ago. Usually when my menstrual cycle comes, it's straight to the hospital. Like I can't take it. I get severe lower back pain, but it's like beyond belief. And I'm just like, that's it. Just take me because I'm not gonna sit here and deal with it anymore. And then I spend about 2, 3, 4 days maybe in the hospital, and then my menstrual cycle sometimes lasts longer than usual. 10 days has been my longest.
I know the feeling.
Yeah, it's not pretty sight.
What about you, Maya or Jesse? Do you guys suffer with that?
No, mine's sporadic and infrequent, so you know.
Okay.
Yeah,
Like,
mine's
maybe.
pretty regular.
Well, I didn't start feeling the pain up until after I got my tubes tied. So, when I got my tubes tied, that's when I started feeling menstrual cramps.
Wow.
And then, yeah, things but, it's not your fault.
You didn't tell me about that side,
right? Right, but you know, I deal with it, and I try to stay on top of my meds and drink fluid and stuff.
I mean, I don't know about you, but
I do.
I mean, there was one time, it was like for 3 years straight. I remember 2009, 2010, 2011. And that's when you recommended several times for me to be on a birth control because my hormones were out of whack, and I kept having crisis back to back. I mean, I can remember 2010, I think I was in the hospital like almost every other month. And that was a lot for me because I don't really get, you know, well, I claim my healing all the time, but but at that time, it's just like I've never been to the hospital like where it was that so much. And then in 2009, I had an ordeal, but we have talked about it several times. But yes, and I do have irregular. But after having my crew, which I call, after having my crew and my miscarriages, and I had several miscarriages, yeah, it does bring on crisis because every time my cycle does come, I do realize my bones start aching, and I don't know. What about you?
Same for me. That's probably why I just emailed Dr. Harrington the other day.
Yes, we do that.
It was when I was like, I think when I was 25, between that, like mid-20s, like 23, 24, 25. It could have been because I was finishing up college too, but I noticed every time my menstruation came on, I would go into a very bad crisis and have to go to the hospital. But I think after maybe 29, 30, it stopped. All of a sudden, it starts flaring up again around the age I am now. Exactly.
I'm going to lean this so it's in the middle. That way we pick up everybody's
14 years.
Okay.
Okay.
Well, the question I was going to ask for Dr. Harrington is because if anybody's had a pulmonary embolism, you can't be on birth control because of the blood clot situation. So what are people supposed to
We're
do
going to talk about that. We're going to ask
if you have a pulmonary embolism because your choices are limited?
Yeah, I mean, generally, just for all women with sickle cell, we try to avoid estrogen-containing birth control because that increases the risk of clots and probably increases the whole vascular reactivity, which is what's going on in sickle cell. So, progesterone only, meds like Depo-Provera is better. It's safer, but it's not completely without risk of clots. Mirena and these IUDs is also safer, but nothing is completely safe. If you have a history of clots that you're not on long-term medicines for those clots, aspirin or something like that would also be a possible recommendation. But
In conjunction with the medicine.
In conjunction with the medicine, but it depends on what seems to be driving how serious your clots have been. If there's a trigger like a port or something like that, but that's a problem. Women who don't have sickle cell, we don't think so hard about putting them on birth control pills with estrogens. We definitely don't want to do that with women with sickle cell.
and you explained why, because of the clotting.
Yeah, and actually they've done studies, and some studies didn't show such a big risk, but in general we think that that's a problem. We also think that estrogens are also a problem with why women have these crises at certain periods. So it's probably it probably is a factor. There's a lot of things going on in the blood vessels, but estrogen is not causes more reactivity and stuff like that.
But going on the birth control, it helps lower the issues. That's what you're saying.
Well, if you're on something, like these hormones, what they do is they just sort of stop your normal signal from the brain to the ovaries to make these eggs, and they prevent you from releasing eggs, right? But the ones that are not the ones that are continuous, like Depo-Provera and IUDs, things like that, have less of a wave cycle, and people have less crises with those.
We got a question. Miss Washington wants to know, so what are the best birth control if you had blood clots before?
None.
If you had blood clots.
If you're avoiding estrogen containing meds, Depo-Provera is not 100% safe. It's just safer than estrogen containing. So Provera is a progesterone, not an estrogen, and Depo is an injection that lasts, supposed to last about 3 months, and then you have to keep on cycling with that. IUDs, which are intrauterine devices, these are another ways we use in birth control. Some are medicine, like Mirena. Some have like copper, different mechanisms to stop you from getting pregnant. But the Mirena has become more popular. It's not necessarily everyone responds to it, but it seems to be better tolerated and safer from a clotting standpoint.
Okay.
I'm just gonna add Dr.
Yeah, we're just gonna try to add her in because
I was pressing it.
and didn't come in. Okay.
Yeah.
So as we give us a second, we're trying to add, for those who are on Instagram, we're trying to make sure our Facebook audience, and we have a doctor who also wants to come on with us today. So ladies, as we talked about administrations, I don't know if any of you have ever had miscarriages or anything, if no, okay, all right. I mean, I have, but I wanted you guys, if you had, So, but if you haven't had, is it? Well, it'll be the cases. What about you, Jesse? Were you ever trying to get pregnant quickly, or did you want it to wait? Did you find it hard to get pregnant, or
No, got pregnant too quick. No, I didn't. Yeah, I wanted to wait, but unfortunately, it didn't happen that way. I mean, fortunately, I don't know how to say that. It didn't happen that way. I got pregnant on the spot.
Okay. Okay.
Somebody say elaborate.
But yeah, I know.
She went straight to
It just came back to back. It was like,
Okay. There's statements, that because of some of the drugs that we take, it makes it hard for sickle cell patients to get pregnant. And what do you think?
Well, hydroxyurea being the main medicine you might take for preventing sickle cell crisis. It's not something every patient is right for every patient, but it is something we don't want women who are trying to get pregnant taking. It probably does decrease some egg development, so it does decrease the chance of getting pregnant. But it definitely, if you're taking it, we immediately stop it if you get pregnant to try to avoid any exposure, because there is, and more in animal models than human models, but sure, we definitely don't want people taking that medicine when they get pregnant or when they're trying to get pregnant. That's hydroxyurea.
Yeah,
It's a low dose of chemo.
Yeah, but it's a different type of drug. It doesn't cause, it is a type of chemo. I'm not trying to say there's nothing wrong with hydroxyurea. I wish we had better options. But hydroxyurea works in a different way. It doesn't cause mutations like a lot of the chemotherapies do that actually damage DNA. This actually just slows how fast you can make your DNA. and but it has a different effect for fetal hemoglobin, and that's but it's still not something that we want anyone taking when they're trying to get pregnant or are pregnant. And we'll have people who are having difficulty getting pregnant, and even if at the risk of having a sickle cell crisis, we try to get them to stop that. Maybe we'll consider putting them on transfusions if that could help them. Other things, other than hydroxyurea, so when they're trying to get pregnant, we are not exposing them to anything that could harm the baby.
Oh, okay.
Okay, we talked about that. Let's talk about just working as women. I know we already over. We get stressed. We get emotional. We got hormones. How do you deal with you know? How do you deal with having a job and trying to maintain a job, paying bills, household, and make sure your stress levels are at a minimum?
Oh. You talking about life?
Yes, exactly. Go ahead. You want to go first?
It's a double-edged sword because you have the last thing you want to do as a chronic illness patient, whether it's sickle cell or anything, is deal with stress outside of the home and then deal with stress at home. If I come home, I want to relax. I don't want to have stress from family members or friends or whatever. Like, that's my peaceful time. I can fight the world when I'm out there, but at home it's supposed to be calm, not too much extraness. But you still want to maintain and clean your house. You want to do laundry. You want to work. You want to cook. You want to do all these things. And I was just cleaning. It's taken me 2, maybe 3 days to sweep all the floors and mop all the floors and clean the back. Like, it's a challenge, because you get tired and you have to take the power nap. And then if you add work on top of that, that's stressful. Sometimes your work and your regular life cause you to have a crisis because everything is hitting you at once. Whether it's you're a student and you're dealing with school stuff, or you're dealing with project at work and you have to deal with ridiculous coworkers or or customers or whatever it is, depending on what your job is. So you kind of have to maintain and find other outlets. I just went to something that was similar to like painting with a twist. But it wasn't that. It was like a modified version. It was called like Pretty Girls Like Trap Music.
Oh,
I was painting with a trap. Painting in a trap.
Yeah, well, no, but it was a DJ and
Yes,
girl.
it's similar.
It was similar,
Yeah.
and then we painted Susie Carmichael.
Oh wow.
From the Rugrats.
Okay.
So that was cool. But it was therapeutic. Because
you get your mind off of it. You're
while
having
you're
fun.
thinking about that, you're having a good time, and you're not thinking about, oh, this hurts, or I have to deal with this project, or so. It's a lot of it is time management and stress management for